Did you know that seemingly harmless grandma's tea could be a silent poison to the health of the elderly? Many plants used in popular infusions contain toxic substances that directly affect vital organs such as the liver, kidneys, and heart. And the worst part, symptoms may be mild or non-existent until the damage becomes irreversible. Experts warn that indiscriminate tea consumption can pose serious health risks such as worsening anxiety, toxicity, stress, blood pressure changes, fertility impact, gastritis, among other problems. The liver is the primary organ affected by the indiscriminate use of infusions with medicinal plants, potentially leading to severe diseases. In this video, you'll discover the 7 most dangerous teas for the elderly, understand how they affect the body, and learn to identify warning signs. Don't let misinformation jeopardize the health of your loved ones. Subscribe to the channel, activate the notification bell, and share this video with friends and family. Information saves lives. 7 teas to avoid for the elderly. 1. Comfrey tea, Symphytum officinale. Comfrey is traditionally used to aid wound healing and fracture treatment. However, its internal use, especially as tea, is highly contraindicated due to significant health risks, particularly in the elderly. The primary concern lies in the presence of pyrrolizidine alkaloids, such as symphytine, lycopsamine, and intermadin, found in comfrey roots and leaves. Studies have shown that these compounds are metabolized in the liver into pyrrole, a highly hepatotoxic substance that can damage liver endothelial cells. In animal models, comfrey ingestion resulted in severe liver injuries, including toxic hepatitis, fibrosis, and even liver failure. In addition to liver effects, prolonged or high-dose comfrey use can affect bone marrow, impairing blood cell production and increasing bleeding risk. In the elderly, who often have compromised liver function and increased sensitivity to toxic substances, comfrey tea consumption can accelerate the development of severe liver diseases. Given these risks, comfrey's internal use is prohibited in several countries. Various international health agencies warn against consuming comfrey-based products, recommending their prohibition for internal use. Therefore, it's essential for the elderly and their caregivers to be aware of the dangers associated with comfrey tea and avoid its use. In summary, comfrey tea poses a significant health risk to the elderly, potentially causing irreversible liver damage and affecting blood cell production. It's crucial to seek medical guidance before using any medicinal plant, especially those with known adverse effects. 2. Rue tea, Ruta graveolens. Rue is a plant traditionally used to ward off evil spirits, but its medicinal use should be avoided, especially by the elderly. Rue tea contains substances that can cause poisoning, leading to symptoms such as nausea, vomiting, diarrhea, and even seizures. In high doses, it can be fatal. Additionally, rue has abortive properties, making it contraindicated for pregnant women. For the elderly, who often use anticoagulant medications, consuming rue can increase the risk of bleeding. Therefore, it's essential to avoid using rue tea, especially in vulnerable populations like the elderly. Side effects and toxicity. Ingesting large amounts of rue can cause severe poisoning, including tremors, seizures, bleeding, vomiting, colic, diarrhea, decreased heart rate, pupil constriction, and drowsiness. Furthermore, when applied to the skin and exposed to sunlight, rue can cause contact dermatitis or burns. Contraindications: rue tea should not be consumed by individuals using anticoagulant medications, as it can cause bleeding. The beverage is also prohibited for pregnant women due to its high abortive risk. Drug interactions. Individuals using medications to control high blood pressure, digoxin or dobutamine, should only use rue under medical supervision, as this plant can alter the effect of these medications. Safe use. Consuming rue should only be done under the guidance of a doctor or another healthcare professional specializing in the use of medicinal plants. It's important to remember that, despite being a natural plant, rue can have significant adverse effects if not used correctly. 3. Spurge tea, Euphorbia tirucali. Spurge, also known as Euphorbia tirucali, is a succulent plant from the Euphorbiaceae family, native to Africa and widely cultivated in tropical regions. Despite its popularity in some cultures as an ornamental plant and even in alternative medicinal practices. Its internal use is extremely dangerous, especially for the elderly. The main concern with spurge is the milky white sap that exudes from its stems. This sap is highly toxic and caustic, capable of causing severe burns on the skin and mucous membranes. Contact with the eyes can lead to intense pain and even temporary blindness lasting up to 7 days. Accidental or deliberate ingestion of the sap or preparations made from it can lead to symptoms like nausea, vomiting, diarrhea, and intense abdominal pain. Furthermore, studies indicate that prolonged consumption may increase the risk of cancer due to the presence of mutagenic compounds in the plant. For the elderly, who often have compromised immune systems and heightened sensitivity to toxic substances, using spurge is highly contraindicated. Ingesting or coming into contact with the sap can exacerbate pre-existing conditions and lead to severe complications. Additionally, the plant may interact with medications commonly prescribed to the elderly, potentiating adverse effects and reducing therapeutic efficacy. Given spurge's high toxicity, it's crucial to avoid its internal use, especially in vulnerable populations like the elderly. In case of accidental contact with the sap, it's essential to wash the affected area immediately with plenty of water and seek medical attention. Never use homemade or alternative preparations without professional guidance, as health risks can be irreversible. 4. Rosary PT, Abrus precatorius. Rosary pea, also known as Abrus precatorius, is an ornamental plant popular in tropical and subtropical gardens. Its attractive appearance with bright red seeds can deceive, concealing the dangers it represents. The seeds of rosary pea contain an extremely potent toxin called abrin. Abrin is a ribosomal inhibitor protein, similar to ricin found in castor beans, capable of causing severe cellular damage. Even minimal ingestion, such as chewing a single seed, can be fatal. The toxin works by binding to the ribosome of cells, inhibiting protein synthesis, and leading to cell death. Symptoms of abrin poisoning can include nausea, vomiting, diarrhea, intense abdominal pain, seizures, multiple organ failure, and, in extreme cases, death. For the elderly, who often have compromised immune systems and increased sensitivity to toxic substances, the risk of rosary pea poisoning is elevated. Additionally, accidental ingestion is more likely due to the seed's resemblance to other edible beans. The presence of children in domestic environments also increases the risk of accidents. Given the high toxicity of rosary pea, it's crucial to avoid cultivating it in domestic environments, especially where there are elderly individuals or children. In case of suspected ingestion, it's essential to seek immediate medical attention. Treatment may include gastric lavage and administration of agents that promote blood clotting. 5. Datura T. Datura stramonium. Datura stramonium, commonly known as Jimson weed, angel's trumpet, or thorn apple, is an ornamental plant containing tropane alkaloids such as atropine, scopolamine, and hyoscyamine. These compounds have potent anticholinergic effects, which can cause a range of adverse symptoms in the central nervous system. Ingesting any part of the plant, including leaves, seeds, or flowers, can result in severe poisoning. Initial symptoms include dry mouth, dilated pupils, tachycardia, fever, facial flushing, and urinary retention. As poisoning progresses, agitation, delirium, hallucinations, confusion, seizures, respiratory failure, and, in extreme cases, coma or death may occur. These effects are caused by the action of alkaloids on the central nervous system, inhibiting nerve impulse transmission mediated by acetylcholine. The elderly are particularly vulnerable to the toxic effects of Datura stramonium. Alterations in liver and kidney function, common in older adults, can affect the metabolism and excretion of alkaloids, increasing the risk of poisoning. Additionally, interactions with medications frequently prescribed to the elderly, such as antipsychotics and antidepressants, can potentiate adverse effects, making consumption of any part of the plant extremely dangerous. An additional concern is the similarity of Datura stramonium to other edible plants, such as cowpea and certain varieties of peas. This resemblance can lead to accidental ingestions, especially in domestic environments with children or elderly individuals. Therefore, it's essential to educate the community about the distinctive characteristics of the plant and the risks associated with its consumption. Recommendations for safety include avoiding the cultivation of Datura stramonium in residential gardens, especially in areas accessible to children or the elderly. Community education campaigns should be promoted to raise awareness about the risks of the plant and the importance of correctly identifying it. Immediate medical attention should be sought in case of suspected ingestion or contact with the plant. Any medicinal use of the plant should be supervised by qualified health professionals due to the associated risks. 6. Aristolochia tea. The Aristolochia cymbifera is a climbing plant from the Aristolochiaceae family, native to South America. Despite its attractive appearance and traditional use in some cultures, its consumption is extremely dangerous due to the presence of aristolochic acid, a highly toxic and carcinogenic substance. Aristolochic acid, the lethal toxin. Aristolochic acid is a natural compound found in various species of the Aristolochia genus. Its ingestion has been associated with serious health issues, including chronic kidney failure and an increased risk of urothelial cancer. Studies indicate that consuming Milhoman's tea can lead to interstitial renal fibrosis within just 3 days of use. Additionally, aristolochic acid is mutagenic, meaning it can cause genetic alterations in cells, increasing the risk of tumor development. Prolonged exposure to this substance has been linked to a characteristic mutational signature in patients with upper urinary tract cancer. As observed in studies conducted in Taiwan, risks for the elderly. For the elderly, who often have compromised kidney function, consuming Aristolochia tea is highly contraindicated. The presence of aristolochic acid can exacerbate pre-existing conditions and lead to severe complications. Moreover, interactions with commonly prescribed medications for the elderly can amplify adverse effects, making the consumption of any part of the plant extremely dangerous. Prohibition in various countries. Due to the proven adverse effects, the use of Aristolochia cymbifera is prohibited in many countries. For instance, in Belgium, in the 1990s, contamination of Chinese herbal products used for weight loss with aristolochic acid from Aristolochia fungi led to the report of dozens of cases of nephropathy, along with an association with an increased risk of urothelial carcinoma. Following these events, several countries, including the United States and members of the European Union, issued warnings and bans related to the use of plants containing aristolochic acid. Safety recommendations: avoid cultivation. Do not plant Aristolochia cymbifera in residential gardens, especially in areas accessible to children or the elderly. Community education. Promote awareness campaigns about the risks of the plant and the importance of correctly identifying it. Immediate medical attention. In case of suspected ingestion or contact with the plant, seek immediate medical attention. Professional use. Any medicinal use of the plant should be supervised by qualified healthcare professionals due to the associated risks. 7. Cinnamon tea. Cinnamon is a spice widely used in cooking and in teas, recognized for its antioxidant and anti-inflammatory properties. However, it is essential to consume cinnamon in moderation, especially for the elderly, due to potential health risks. Properties and benefits. Cinnamon contains bioactive compounds like cinnamaldehyde, which confer antioxidant, anti-inflammatory, and antimicrobial properties. Studies suggest that moderate consumption of cinnamon can help reduce blood glucose levels, improve insulin sensitivity, and contribute to cardiovascular health. Additionally, cinnamon is rich in fiber, calcium, and iron, essential nutrients for the proper functioning of the body. Risks associated with excessive consumption. Despite its benefits, excessive consumption of cinnamon can lead to adverse effects, primarily due to the presence of coumarin, a substance found in cassia cinnamon. Coumarin, in large amounts, can be toxic to the liver and increase the risk of bleeding. Moreover, excessive consumption can cause gastrointestinal irritation, such as nausea and vomiting. For the elderly, who often have compromised liver function, consuming cinnamon tea should be avoided or done with caution. It is crucial to monitor intake and adjust dosage according to individual needs. Special considerations for the elderly. Elderly individuals with pre-existing conditions such as liver, kidney, or cardiovascular diseases should pay special attention to cinnamon consumption. Interaction with anticoagulant medications like warfarin can increase the risk of bleeding. Additionally, cinnamon can affect blood glucose levels, interfering with diabetes treatments. Safe consumption recommendations. Variety choice. Prefer Ceylon cinnamon, which contains lower levels of coumarin compared to cassia cinnamon. Recommended quantity. Limit consumption to about 1 to 2 grams per day, equivalent to approximately middle to 1 teaspoon. Monitoring. Be attentive to possible adverse reactions, such as gastrointestinal irritation or signs of bleeding, and adjust intake as necessary. Medical consultation. Before starting regular cinnamon consumption, especially if using anticoagulant or hepotoxic medications, consult a healthcare professional. Although cinnamon offers various health benefits, it is essential to consume it in moderation, especially for the elderly. Choosing the appropriate variety and medical supervision are crucial to ensure safe consumption and enjoy the beneficial properties of this spice. While natural teas may offer health benefits, it is essential for the elderly to use these substances with caution. Many medicinal plants can interact with prescribed medications, enhancing or diminishing their effects and even causing adverse effects. Therefore, before starting the consumption of any tea, it is fundamental to consult a healthcare professional to assess potential risks and determine the appropriate dosage. We have reached the end of this video, but awareness about the risks of teas for the elderly does not end here. The indiscriminate consumption of teas can cause serious health damage, such as intoxications, severe liver problems, and interference with medication absorption. Experts warn that, although teas are natural, they can interact with medications and affect vital organs, like the liver. It is crucial for the elderly and their caregivers to be aware of contraindications and potential drug interactions. Before starting the consumption of any tea, it is imperative to consult a healthcare professional to ensure safety and well-being. If you found this video helpful, like, share, and subscribe to the channel for more information on health and well-being. Activate the bell to receive notifications of new videos. Have questions or suggestions? Leave your comment below. We're here to help. Senior Health Matters.